Hello, my name is Eric Stoeffler. My presentation will be over Cordylobia, anthropophaga or phaga. I hope I pronounced that correct. Common name is the mango worm. It has a few common names, but that's the one I've heard. I chose this parasite because, well, it's pretty interesting. You hear a lot about the bot fly here in the U.S., but the mango worm is kind of another, like a related to the bot fly. And the fact that you do have, things like this, right? It's a worm that's buried in the epidermis, the skin. So, and there's usually quite a lot of them. So, let's go ahead and get started. All right, so morphology. I have a few pictures here to show you. But typically the larvae, this one right, the middle picture right there, it's pretty typical, about 12 millimeters in length, yellow brownish color, pretty gross looking. The top picture there I think is an artist's rendition of it, but it shows what you would see if you were looking at it from looking at the patient. So the top of it with where the skin is open. So that's you're looking basically at where it's breathing. Um, so there's stripes on the thorax, black bands on the abdomen. Yeah, the oral area has a pair of tooth like hook type of thing, so it can really latch onto the host and dig in and eat while it's growing. You can also see in the middle picture there are some kind of spiky areas which are used again to latch on so it doesn't fall out of the host before it is done growing or it's ready to fall out. And then I also included the picture of the actual fly that lays the eggs. So I feel like it's a pretty typical looking fly. All right. Function. So talked a little bit about this in the last slide with the morphology. But basically, again, similar to the botfly, it has hooks hook into its host while it's eating so it doesn't fall out prematurely, because it wants to make sure that it can eat and fully grow before it is time to fall out, so that it has plenty of food and fat reserves to turn into the adult fly once it does fall out. But you can see in the pictures some of those hooks. I think they're pretty interesting looking. All right, so life cycle. So this is where one of the places that the mango worm and the botfly differ pretty significantly, actually. So with the botfly, you have the female laying the eggs on a mosquito, but with the mango worm, there is no real intermediate host. So the female fly lays her eggs in soil or sand. The sand is going to be contaminated with feces or urine of some kind from the mammal host. That's because, well, they want a mammalian host for their larvae. And so we're better than where the mammal has been already. So yeah, the female's gonna lay her eggs in the sand or the soil. Let's go to the next slide. So when the eggs hatch, they will attach themselves to the host, whether it's human or dog or cat. Usually, a domestic animal is pretty common for the mango worms. Humans can be hosts as well. And since there is the sand part of it, where the fly lays all her eggs in the sand, there can be quite a few. I think that from what I've really seen, I think that these pictures are a little extreme, but it can happen. A lot of the picture on the right actually is from a video of a veterinarian in Gambia, I believe, that deals with a lot of these dogs that get infected with the mango worm, and but I think these are severe cases, whereas typically it's going to be like one or two larvae in the skin. But once the larvae get to the right size, they're going to fall out of the host into the soil or the sand, whatever substrate they land in, and they're going to bury themselves until they're fully grown, and then it starts all over. So the female fly is going to find some contaminated sand or soil to lay her eggs in, and then a mammal is going to come and roll around in it or lay in it or just walk in it. Obviously, probably the most common area that these infections are going to happen are probably going to be the feet. So yeah, pretty gross. So clinical presentation, you're going to have these basically boils in your skin where the little wormy is. It's going to be kind of red around the area. So it's going to be pretty obvious. And once they're removed, you're going to have some holes where the larva was. So some other ones, you're going to have some itching, which is, I feel like, pretty common. If you have something burrowing inside you, you're going to itch it, try to get it out. Same as like if you have a mosquito bite or something, which that's not necessarily something inside you, but yeah, if you have something that's crawling on you or inside you, I feel like you're going to try to itch to get it out. Discomfort or pain, again, I feel like that's pretty obvious one, because again, you have something digging and trying to eat you. Blister-like lesions, which are where the actual larva is in your skin. Redness, you're getting eaten by a worm, so it's going to be red. Sensations under the skin, so you might feel the thing moving around inside you. A fever, so possible fever that comes from it. Tachycardia, so it's probably severe, but your heart can get into a odd rhythm, and insomnia. And I feel like that kind of goes along with sensations under the skin. If you feel something that is moving around inside you, it's going to be very hard to sleep. I know I wouldn't be able to sleep if I knew there was a wormy inside me. So pathogenesis, talked about this a little bit in the life cycle of the mango worm, but basically you're gonna have the larva in the contaminated substrate, sand or soil or whatever. The mammal is going to walk through it or lay in it or whatever the mammal does in the substrate, and wherever that mammal, wherever it connects to the substrate is going to get infected. So I think most commonly is the feet, because that's the most common part that's on the ground. But if you lay in it, you could get it in your ear, your lip, your face, your chest, wherever you actually touch the substrate. So, I can get all over. So as far as where it's located, tropical regions of Africa, south of the Sahara. It can be found worldwide. It's not as common as in the areas of Africa, but this is typically due to travel. So the eggs could be brought on clothing or on backpacks or something, or you can have the larvae in your skin while you're traveling, and that could bring it to wherever you live, be it the US, Canada, Europe, wherever that is. So prevention, obviously, since the fly lays its eggs in the sand or soil, try to stay away from contaminated sand or soil. If you are in Africa washing your clothes, just try to do it in an area where the clothes or the room is closed off from the outside. But if you can't do that, then just iron your clothes. The heat from the iron should kill the eggs, so especially pay attention to the seams of your clothes. And avoid putting backpacks and stuff on the contaminated substrate. So basically just stay away from the soil or the sand. It's contaminated. That's where the eggs are. All right. Treatment for the mango worm. There's a few different ways that treatment can work. So hydraulic expulsion is kind of what it sounds like. You have lidocaine or epinephrine, and it's squirted into the wound, and the theory behind this is it basically the pressure of the injection pushes the worm out. So that's one way. Suffocation, this is a more common way probably. Basically putting something over the hole that the mango worm is in, so a piece of tape or petroleum jelly or I think nail polish or something like that will work, and you just leave it on there for a while and let the worm suffocate, let it die. And then once you remove the covering, hopefully it just falls out, or you can just squeeze it out or take a pair of tweezers and get it out. So, but it's dead, so the hooks and things should be pretty limp, so it won't be too hard to get out. Squeezing also, I think typically a medication like an antiparasitic is used before the squeezing, but squeezing, you can just squeeze it out of the burrow that it's in. I wish I could show you the video, but basically there's a doctor in Gambia. He deals with dogs. He's a veterinarian, but his whole thing is squeezing them out, and it is very interesting. I encourage you to go and watch these videos if you can. They're pretty interesting to watch. You can't really look away once you're watching it. They get addicting, at least to me. Maybe I'm just weird. But anyways, so that is my presentation over mango worms. Hopefully you enjoyed it. Thank you for listening.